Notice: the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual doctors or patients. Thank you. Speech-sound disorder, SSD, is a communication disorder that impairs an individual's ability to form the correct sounds expected for their age and dialect. This disorder, affecting both children and adults, can have significant impacts on communication, social interaction, academic achievement, and overall quality of life. SSD is characterized by difficulty in producing specific sounds, articulation, or using sounds correctly in a language, phonological processes. Articulation disorders involve problems making sounds. Sounds can be substituted, left off, added, or changed. These problems are often noticed early in a child's life as they begin to speak. On the other hand, phonological process disorders involve patterns of sound errors. For example, young children might simplify complex words by replacing difficult sounds with easier ones, or by omitting certain sounds, which is normal to some extent. However, if such patterns continue past the expected age, it may be indicative of SSD. The causes of speech-sound disorders vary. They can be developmental, with no known cause, or they can result from other conditions, such as hearing loss, neurological disorders, brain injury, or cleft palate. Genetic factors may also play a role, as SSDs can be observed running in families. Diagnosis of SSD typically involves a comprehensive speech-language evaluation. This evaluation includes a detailed analysis of the person's speech-sound production and may involve standardized tests, speech sample analysis, and physical examination. The speech-language pathologist, SLP, will consider the age of the individual, the sound errors observed, and the impact of these errors on overall communication. The impact of SSDs on an individual can be far-reaching. For children, these disorders can affect the development of language skills, leading to difficulties with academic performance, particularly in reading and writing. Children with SSD may also face social challenges, such as difficulty participating in conversations, which can lead to frustration, embarrassment, or social isolation. Adults with untreated SSD may face challenges in professional and social settings, where clear communication is essential. Treatment for SSD typically involves speech therapy with an SLP. The therapy focuses on teaching the individual how to produce the specific sounds or sound patterns they are struggling with. This may include demonstrating how to move the tongue to create specific sounds, helping them understand when sounds are made correctly or incorrectly, and providing exercises to practice sounds and improve speech. The length and type of therapy depend on the severity of the disorder and the age of the individual. Technology has also played a role in treating SSD. Apps and software programs can provide additional practice and feedback, often making the learning process more engaging for children. In conclusion, speech-sound disorders represent a significant barrier to effective communication, impacting both personal and social aspects of life. Early diagnosis and intervention are crucial for improving speech sounds and enhancing overall communication skills. With appropriate therapy, individuals with SSD can make significant improvements, highlighting the importance of awareness and access to specialized speech-language therapy services. Notice: the images of people appearing in the video are for illustrative purposes only. Thank you for watching.